This is Fred Lippman coming to you from Nova Southeastern University. This program is called Dateline Health. You might notice that I just took off my mask. Let me introduce to you two very interesting individuals and the topic today is neuromusic therapy and the International Aphasia Choir. First, let me introduce Trent Barrick. I cannot know what those acronyms are, Trent, and you'll be able to tell us. And you're a neurologic music therapist and the founder and CEO of Neuro Music Therapy, LLC. So tell us, Trent, what is it all about?
Thank you so much for having me. It's a real honor. And of course, my name is Trent Barrick. I'm the CEO of Neuro Music Therapy, like you just said, and the credentials stand for Neurologic Music Therapist and also Music Therapist Board Certified. So that's where the MTBC came through. So the company is really founded on a neurologic music therapy approach to music therapy. We are an evidence-based practice. You can consider neurologic music therapist as stimulus specialist. So we know how to uniquely use music to address a wide range of focus areas and specific needs. And all of our foundations we're founded in education. So the career of music therapy is a beautiful career. Music is powerful, music is very influential, and we've noticed from, since we've got our start in the 1960s to today, there's been a paradigm shift from music being seen as a social science to more of a neuroscience, right? And so we're understanding how music can affect an injured brain. It can engage an injured brain and retrain an injured brain in the areas of speech, motor, and cognition. And so we can influence behavior functions. And so it's the perfect use and the perfect tool, especially in maybe a neuro rehab setting or neuropediatric setting, where there needs to be that type of rehabilitation. And music is, everyone loves music, everyone responds to music. Music is the brain's language. And we know that a brain that engages in music is changed by music. And so that's the core of who we are. We promote and we advocate, we educate, and we're just in the community for the community. We want to be in families' lives and use music in a specific way to help them reach their own goals, whatever that might look like. So that's who we are in a nutshell, and I'm just so happy I get to do what I love to do for a living. It's incredible.
And Gillian Velmer, tell us what your acronym after your name is all about, and tell us about, I know you're the founder and director of Sing Aphasia, and you're the co-founder of the International Aphasia Choir. So let's tell the folks what that's all about.
Sure. Thank you. Thank you so much for having us. My name is Gillian Velmer, and I am a speech-language pathologist. And I work in public schools full-time. So most people, when they think of speech therapy or, speech therapists, we think about working in schools. But the reality is that the field is so diverse, and there's so many different areas of speech and language therapy. And so I work full-time in public schools with preschool through fourth graders. But on the weekends, I get to engage in another one of my passions, which is working with adults, stroke survivors, brain injury survivors who have aphasia, which is a language disorder that can occur after stroke or brain injury. And so sometimes there is difficulty speaking, reading, and writing after a stroke. And there's research that shows that singing can sometimes help with that and engaging in music, like Trent was saying. And so that's where Sing Aphasia comes in. We are a community-based organization. We are currently in pursuit of nonprofit status. So we're very excited about that. We've worked very hard over the past several months. So we are currently providing a weekly Zoom choir. We have exciting parking lot rehearsals where they are safe, where we can sing together in unison in our cars, through our radios. We're doing some really fun things. And then, of course, we have the International Aphasia Choir as well.
Let me ask you, firstly, explain to the folks what aphasia is.
So when someone has a stroke, depending on the location of the stroke or the brain injury, sometimes it is also a neurodegenerative disease, so a brain disease. Typically in the left side of the brain, if there is injury there, and if it affects the language centers of the brain where most communication is processed in the brain is on the left side. If there's injury to that side, then that will affect language, speech. And so oftentimes people who have that injury on the left side of the brain, they do have some difficulty with speaking, reading and writing, and some comprehension. However, it's important to know that intellect, their intelligence is not affected. And so there's research about the benefits of music and music therapy, especially music listening, but engaging in music. What we've thought of as, the left side of the brain is really the analytical side, reasoning, things like that. And then we think of the right side of the brain as being the more artistic side, creative, and that's where music comes into play. But what current research is showing that if you're engaging in music somehow, it's not only the right side of the brain, it's really lighting up all areas of the brain. So MRI scans have shown that the brain just lights up like fireworks when people are engaging in music. And that's what is so cool about using music and using music therapy. And what Trent had mentioned, evidence-based practice in using music to help stroke survivors and brain injury survivors. There's something called neuroplasticity that, regaining some of those skills in the brain and being able to make new connections even after an injury, because music is just all over, lighting up all areas, making those new connections, strengthening some of those other connections. So that's why, we know the importance of using music in our everyday work with our members and our patients.
So Trent Barrick, let's get to you now. I wanted to get our speech therapist to give us some commentary about what actually aphasia is, but tell me, what is the extent of your involvement? Is it South Florida, or is it limited to Broward County? Tell me something about that.
Great question. So currently my practice, we serve primarily South Florida. We're in Palm Beach County, Broward County, and Miami-Dade County, seeing a variety of patients, participants, clients. Because of the pandemic, there was a big shift now that we're doing telehealth services as well. So effectively, we can ethically reach any person and take on any client in any state where there is not music therapy licensure in place. Florida is one of the states that unfortunately doesn't have music therapy licensure yet, but many states have already developed that license. So any state that that has a license, I cannot take on clients, I cannot practice ethically. But something to what we are about is just giving back to the community, and something that we were able to kind of get over that bridge is creating an opportunity for free, where we're creating a community such as the International Aphasia Choir, and we're inviting anyone with aphasia, whether you are a family member affected by the effects of aphasia, or you have aphasia specifically, where you're able to just join us online, because the pandemic really cut a lot of these resources out, right? The pandemic stopped people from getting to go to support groups. It was a very isolating experience for many people, especially for people with aphasia who already feel isolated and have to kind of, really adapt to this new normal that their bodies, are now having to work and experience. And so we just wanted to create the opportunity, over telehealth, use this platform, use this time. In the back of my head, never waste a pandemic, never waste the moments to find the silver lining in the chaos. And that's what, my heart wanted to do for these people that I had a particular just love for. There's nothing better I can describe it for than just a passion for these specific people. And it's been beautiful because with the International Aphasia Choir, we've effectively, in our first video, we reached five continents. We've had participants from 5 continents, 55 families from 5 continents participated online in our online community. They submitted videos to be part of our final project. And now we're on project 2. And Dr. Gillian, I think we have over 100 plus people, 100 plus families from different continents that are joining us.
There's a lot of talk about the effects of this COVID virus 19 involvement with people having the loss of certain mental capacities, physical, motion capacities, and I would assume that in listening to our speech therapist, that there might be, and you have to tell me, there might be some effect upon the ability to communicate. So tell me if that's true.
Oh, absolutely. Yeah. And as Trent had mentioned, aphasia is already an isolating disorder. If you can imagine not being able to pick up the phone to call a friend, order a pizza, go out and order, movie tickets when you go out shopping or, anything. It is already very isolating and difficult for people affected by this to communicate. And the pandemic, and so also transportation can be difficult for this population. Sometimes people are affected with some sort of paralysis, usually on one side of the body after a stroke. But everyone is different. It affects everyone differently, but sometimes transportation is hard. And so these people are usually stuck in their homes. And so, before the pandemic, this was already very isolating for them. And having the pandemic where we have to stay in our homes, we're all being very isolated. And I love how Trent used the term silver linings, because the silver linings of this pandemic is that we have been able to reach so many more people through technology. And we are, learning technology might be difficult for some, but, we're really proud of the work that we have done and that we have taught people how to use technology to connect with each other from all parts of the world. So yes, we have over 100 families signed up for our second video. We're hoping that we get 6 continents this time.
And I'm just wondering whether you have thought about the effects, at least the reported effects of the sequelae or the effects of the COVID.
What I believe you're referring to, at least how I see it, is when younger children, the effects of this pandemic on them, could really be on their social skills, not being able to socialize with peers of their age. Libraries are closed, the parks were closed, and they don't have those experiences. Schools were closed in the beginning of this. So there is definite, effects of socialization, emotional mental health for sure. If they're not seeing those kids of their in their schools anymore, being able to practice those skills. It's a very, especially young kids are just learning to use words and use gestures to communicate. Absolutely, there are effects there.
Just to make you aware of the fact that we have a major cooperative library with Broward County on our campus, and it's the Alvin Sherman Library, and it's open to the public, but they have to wear a mask and they have to be seated in a proper distance, et cetera, but we're open. Do you think that that you are going to be able to impress major education institutions, I'm talking about the K through 12 institutions, to get back to getting some of the communicative responsibilities that they have back into their systems, so that something like your neuro music therapy is accepted and adored?
Excellent question, and thank you for asking that. One of the beautiful things about this pandemic is that it's really refined our ability to be aware of things like infection control, right? And so we're definitely going by the latest research, the latest CDC guidelines, to help us know as, music therapists, how do we approach safely, creating an environment where our participants can thrive. And so what does that look like when it comes to singing, when it comes to active music making? And so infection control has been our forte. Safety has been our forte. I can say happily that my company is already back in the school system. We're not just doing telehealth, we're already back. We actually are partnered with Broward Children's Center, and we serve their PPEC and their preschools. And so we're already back working one-on-one with individuals safely. We wear our PPE. We don't do groups at this time, but of course, if we were to do groups, it would be 6 foot distance. We would just create the parameters for safety to be at the forte. I cannot, of course, I cannot mandate vaccinations, but I can encourage it just based on the education that's given to me as a CEO, as a business owner. And of course, I'm scheduled next week for my own vaccination. I actually am a COVID survivor myself. I had it back in October, and I had long haulers for quite a while. So I know the effects of COVID, and I'm very well aware of what it can do to the body. I'm certainly glad that I'm at this point in my recovery, and I definitely encourage my contractors, my employees, to make safety number one, especially during this time. Safety for the patients, safety for themselves. It's incredibly important. And just to say, believe it or not, music therapy actually helped me with my recovery. I was in isolation for a month because I developed COVID pneumonia. And then when I came out, I had ataxia in my gait. I was very weak. It was very hard to walk. I had the brain fog. I had the short-term memory loss. I had issues with word finding. So it's very ironic that I was part of developing the International Aphasia Choir, because we see the language, and I experienced it firsthand. Language is hard. Word finding it can be hard, especially when you have these competing things going on in your brain that's causing this stress. It's a very compounding experience. And one of the things that helped me with my gait was a technique from Neurologic music therapy. I was working one-on-one with a girl around my age who had a stroke, who also had an ataxic gait pattern. And as soon as we incorporated the rhythmic auditory stimulation, the metronome, the whole process, I noticed my gait speed, my velocity increased, my stride length improved. I no longer had this sensory motor issue of planning where my next step would be. I didn't even have to think about it because my body was literally being overridden by this external stimulus. So I can say that what I do actually helped me improve on a personal level, even with my speech, finding words. I had, I guess, paraphasia, right? Someone held up a Santa Claus doll to me. I couldn't tell them what it was. This was just back in December because I couldn't find the word. It was surreal. It was surreal. And of course, I would grab at other words trying to fit. Pumpkin spice latte, happy holidays. It was almost there, and so I experienced quite a bit, and it was beautiful because I was working with participants with aphasia. A lot of times their caregivers would just pat me on the back and say, "Hey, it's okay, we understand." Because sometimes I was struggling in therapy too. So it was a very hand-in-hand experience where, I was not only giving, I was getting. And I really felt connected to that population.
Okay, I don't mean to interrupt you, but we're down to the last 2 minutes of the show. And I'd like to just ask Ms. Velmer, tell us about the International Aphasia choir?
At the start of the pandemic, Trent found my website and contacted me and asked me, hey, do you want to put together a virtual aphasia choir? Of course, I said yes. I have a lot of connections to aphasia choirs around the world through my master's and my doctorate. And so I said, absolutely. We started recruiting. June is Aphasia Awareness Month in the United States.
Down to the last few seconds of the show. Just give us a telephone number that we could reach you, or somebody could reach you if they're interested, and we'll put it up on the screen, okay? Trent Barrick and Gillian, Velmer, thank you very much. It's been a very interesting format and direction for this program, but there have been a lot of people that have been asking us questions about not only obviously we got involved in the pandemic issues, but you know, there are a lot of children that are born with problems relative to communication. And you know, people automatically say, oh, they're autistic or whatever, but it's not always that case. Most often it's not. And we're very interested in knowing what you do. So that's why we asked you to be the presenters and the subject matter of a program. So thank you both very much. Trent Barrick and Gillian Velmer, thank you very, very much. Trent, I wish you well in exposing the assets of Neuro Music Therapy LLC. I would assume that you are going to expand dramatically because of the needs of the people. And Gillian Velmer, thank you as a health professional for being so dedicated to the people of need, both the people who are injured as well as the people who perhaps have a birth-related issue. So thank you both very, very much. We appreciate you being here. Like I said, this program is really created by comments that come from our viewers. And I guess after 21 years, they know that I'm going to get them some kind of an answer. I don't give them the answer. I let the guests give them the answer. So thank you very much for appearing for us today on Dateline Health. Folks, remember, I always tell you that you've got to take good care of yourself. And needless to say, you know, we're still in this era of non-knowledge, really, as to what this COVID-19 viral insidious level of involvement in our community is all about. So let's just listen. Let's take good care of ourselves. Let's respect our neighbors. And just remember that Dateline Health is here for you all the time, not to answer your immediate questions, but to entice you to ask questions of yourself so that you can remand them to a telephone number or an email address right here, and we'll try to get you the answer. Remember, this program is called Dateline Health. My name is Fred Lippman. Until next time, see you.